Esophageal cancer and the operation for esophageal cancer is still kind of one of the bigger operations that we do. A lot of patients with esophageal cancer will present with metastatic disease, and unfortunately those patients are not candidates for surgical resection. So when we talk about surgery for esophageal cancer patients, it's early to locally advanced disease stages, so stage 1 to stage 3 esophageal cancer. And most of the time that's stages 2 and stage 3. It's unusual that we find esophageal cancer that early on where it's just a stage 1 lesion because there generally are no symptoms associated. Locally advanced esophageal cancer is best treated in a multimodality way, which includes chemotherapy and radiation up front, and then surgical resection 6 to 8 weeks after the completion of chemotherapy and radiation. And that is to sort of have the best chance of curing that patient. We know that a lot of patients with esophageal cancer will get metastasis down the road, and so doing all 3 treatments is the best way that we have to try to give the patients long-term survival. The operation is a large operation, like I mentioned. It generally is about 5 to 7 days in the hospital. You do remove a good portion of the esophagus, and then you have to kind of recreate a tube for them to be able to eat through so that they can eat normally. And so that just entails a lot of surgery and ultimately using the stomach to reconnect and remake a tube for them to be able to eat through. So it is a big operation, usually about a week in the hospital, and then the recovery after that is anywhere from 6 to 8 weeks, really, before the patient is kind of feeling back to 80 to 100% of their norm after surgery. And you have to remember, when they have chemo and radiation going in, they're already a little bit sort of, they've been put through the ringer a little bit already before surgery, so then you add a big operation on top of that. But with a good team of people and with a lot of support, it's, you can get people through and they can have long-term survival.